Hey guys, how you doing? So I thought today that I would talk about Sever's disease because this is my daughter. How old are you, Kayra?
10.
And she has heel pain, and she's got, and it's on both feet. So here's our little interview of Kayra. She's a little nervous.
Don't say that.
Okay. I'll don't worry about it. Shh. Okay. You ready? Kayra, when do your heels hurt?
When does it start?
Yeah.
On Saturday, I do a lot of dancing, so it starts hurting by the end of Saturday. And yeah.
Yep. So what type of dancing causes the pain?
I do ballet, sometimes in my jazz shoes, and then sometimes in my tap shoes because they're pretty small.
Yep. So how many hours of dancing do you do on Saturday?
6 hours.
Yep. So 6 hours on Saturday. And how long does the pain last for?
About 2 days.
About 2 days. Then it goes away? And does it hurt when you walk?
No, not really.
No. And is there any pain along that tendon at the bottom, the back of the heel?
Yes.
Yeah. And it causes you to limp sometimes?
Well, if I really try my best, probably.
Yep. And 2 days later it stops and then it starts again when you dance again on Saturday, right? And this has been going on for a few months. So these are the shoes that Kayra dances in. So, you know,
My jazz shoes.
there's a jazz shoe?
Yeah.
Yep, so those, flimsy ones that you can, anyway, everyone knows those. So, Kayra, what we're going to do is let's assess your heel. And like always, because I like drawing on people's feet, we'll draw on your feet a little bit. Now, we're at my house. So we're going to get Kayra on the coffee table. So I'm just going to have to make you comfortable. How about we chuck these pillows on there? Yep. I couldn't be bothered going to the clinic. So we've got my pens there. Can you jump up, Kayra, and tell me if you're comfortable or not? You cool?
Yeah.
All right, how am I going to do this with one hand? All right, so I'm going to... Okay. Whoa. All right, let's... Sorry, guys, I'm going to have to swap hands from time to time. Okay, so... Yeah?
You can use that.
No, it's all right. I'll just hold it in my hand. All right, so let's have a look at the Achilles tendon. So there's the Achilles tendon there. Let's just draw that in. Kayra, can you just push against my hand? Keep on pushing. Yep, keep pushing. Cool, and stop. So the Achilles tendon will go up and eventually become the aponeurosis. Let's try to just make a makeshift calf muscle there. So we've got the aponeurosis here. As it comes down, then it becomes the Achilles tendon. Then the Achilles tendon is going to then branch out a little bit and attach to the calcaneus itself. Now if we take the foot and look at the lateral aspect and we just go down, I can feel the posterior aspect. So there's the edge of the malleoli. There's the posterior aspect of the heel here. Now the fat pad, so this all looks soft. This all looks soft here. I can feel it, so it's coming up. Calcaneus is coming up around there. That's still fat. Probably come around something like that. And then we'll have, obviously, the fat pad around here. Now, if we look at a lateral x-ray, how am I going to draw this? The growth center, so the actual apophysis, doesn't start up here. So this part here, that's not where the apophysis is. It starts around there. Then it will come down, something like that, and go a little bit plantar. So we will end up seeing on that x-ray, you know, that the black gap. Let's see if this blue pen works. So we will have one part of the calcaneus there, and then the other part of the calcaneus here. Yep, so something like that. So let's have a look at how we're going to test this. So I guess if I got Kayra to jump up and down on the ground, it would probably hurt her heel. We can do the lateral squeeze test, which we're going to perform in a sec. The first thing that I would do is I'll start at the aponeurosis, and we're going to start pushing. Kayra, you should only feel pressure, but it shouldn't hurt, okay? Feels okay? You tell me once it starts to hurt.
Yeah.
Starts about there?
Yeah.
Let's get the orange texture. So that was about that level here. Sore? Yep. How's that? Hurts? And when I get up to here?
Yeah.
So there's actually no pain here. Let's keep on squeezing. How's that feeling?
It's fine.
How's that, Kayra?
Yeah, that's no pressure.
Hmm?
Just no pressure.
Good, so you're better today. Because it's, what day is it today? It's Tuesday, so you've had a couple of days to calm down. Huh?
No, it's Tuesday.
It's Tuesday, right? Yeah, so you've had a few days. So it's pretty sore here the other day. So when I push on that, how you feel?
Oh, it hurts a bit.
Hurts a bit, not too bad though? Yeah, so tons better. So when I saw Kayra initially, when she said, Dad, I've got a lot of pain, she had no pain here, up there. But once we actually got to the apophysis here, all of this was quite sore with the squeeze test and then just direct palpation as well. And these areas were sore. So that hasn't changed. But this is tons better, isn't it? Awesome. Anyway, that's where it was hurting. There was one thing that I missed, and that's normally when I look at the feet. She does have it on both heels, but there's really no asymmetry between both heels. There's no edema present. There's no erythema either. Her flexibility, her calf muscle flexibility, how does that feel, Kairosh? It doesn't hurt. She's got good ankle flexibility. There's no pain when I dorsiflex it. There was no pain when I tested her initially on Saturday after she complained about it. So when would I? So if I know this is a self-limiting problem, and there's probably a little bit. Yeah.
Can you put a pillow under my foot because
Okay.
it's hurting when you push it down like that.
Oh, okay. Pillow under the foot. Okay. How's that? All right, come down a bit. There we are. That's still cool. All right, so I know this is a self-limiting problem, and there's probably minimal evidence on exactly how to treat this problem. But Kayra does lie in that age group that would get this type of issue. She's 10, normally pops up around the age of 7, 8, and starts to end around 15-ish when the actual apophysis is closed. She's she's active. Obese kids can get it as well. In her case, it's activity. She doesn't get it when really with walking or anything like that, and it does calm down after about the third day. If it didn't calm down and we integrated treatment, I would get an x-ray. So if she continued to limp, I'll get an x-ray. The lateral view will show you the most info. The reason I would get that is just to rule out any weird stuff. If there was any bone cysts around here, if there was a stress fracture of the calcaneus, I wouldn't want to miss that. But once again, I'd only x-ray if pain didn't resolve. I haven't seen Sever's disease for a number of years. These kids just don't present to me anymore. because of the type of work that I'm doing now. But what I'm going to do with her, I'm going to try taping her heels this Saturday before she starts dancing. In those flimsy shoes, I'm going to put a heel raise. I'm going to make it out of 10mm pour-on, and I think pour-on will absorb shock better than this and may work a bit better. That's my gut feeling anyway. And then I'm just going to make a pour-on heel raise. One of our podiatrists, Amy, mentioned that she should do some eccentric exercises with Thera-Band. I'm sure that all of you know how to do that with Thera-Band. And I'll give her some gentle calf muscle stretches as well. When she is comfortable with doing the eccentric exercise with the Thera-Band, I'll probably get her to do that off a step. I'm going to ask her to rest during dancing if she gets pain. If those things don't work, maybe we can try a heel cup or an orthotic. But she really doesn't get the pain outside of dancing. So I'm not sure what would the relevance of an orthotic be? Because she doesn't get it any other time except dancing. So probably just the heel cup. If the pain gets really severe, I'm just going to get her to stop dancing. If she did get it with walking, I would use an orthotic. And if that didn't work, I would immobilize her probably with a cam walker. Guys, thank you. It's just a nice quickie. Bye.